If a physician declares to you or a friend it is definitively cancer, for most of us a word crashes. The fear of death becomes a real issue. Do not let you be pressed by nobody. A tumor needed years until it can be diagnosed, perhaps 10 years. 2 weeks of thinking about are not too much. A physician who presses you doesn't take you seriously. Look for a better one. It is your life, not his. Let make a second diagnosis from another independent doctor. Wrong cancer diagnoses are not unusual. By the highly informative book of Lothar Hirnase, chemotherapy heals cancer and the word is flat. Be aware of all good pieces of advice and references of cancer authorities, if official and alternative. Be critical. Use your own brain. How does a malignant tumor develop? In spite of many current but wrong theories, we exactly know from stem cell research how a tumor develops. In all tissues, there are cancer precursor cells or progenitor cells. Exempted are heart muscle cells and nerves. Therefore, these cells never can become malignant. Normally, these progenitor cells are sleeping. If they are awaked, a tumor can develop. Many tumors stay for years at a very small stage. They are effectively controlled by immune response. Only some of them develop further. What awakes progenitor cells? The most important reason, 80%, is physical or emotional stress. Other reasons are poisons, UV light, over-acidification by unhealthy food, electric radiation, cosmic radiation in flying stuff. Some people also see Earth radiation as a reason. Cancer cells have lost an important feature, the ability of a controlled suicide for apoptosis. Why is it so important? A cell only can renew by cleaving. 2 cells will remain, in the next step 4, and so on. Only if one of the new cells has to perish, it is possible to avoid a tumor. Where is the ability of apoptosis located? You still can hear the obsolete theory that a genetic mutation in the cell nucleus causes cancer. If you remove the nucleus of a healthy cell and replace it by the nucleus of a cancer cell, the cell and its descendants are healthy. A healthy nucleus in an enucleated cancer cell causes cancer cells. This means the ability of apoptosis is not located in the nucleus and its genetic material, but in the cell plasma. There, mitochondria, the power stations of the cells, are responsible. They secrete a substance, cytochrome C, and start apoptosis thereby. If the membrane of mitochondria is tight, however, this is impossible. This is the case in tumor cells. In the medical world, still the idea of metastasis haunts the mind. Cells are thought to emigrate from a tumor to the bloodstream, what they do, and settle at other organs, starting a tumor there. A gut tumor, for example, shall settle in the liver. From the until now unsuccessful trials of transplantation by transfusion of cell suspensions, we know that liver cells always settle at liver tissue and kidney cells to kidneys. Please remember progenitor cells. By the same causes, they can be awaked in different organs, forming tumors at different times. Progenitor cells are very effectively awaked by radiation and chemotherapy. So, if so-called metastases occur after treatment with them, it is not unlikely that a secondary tumor is caused. It is well known that most people do not die from primary but from secondary tumors. This should be used as an opportunity to think about these therapies. Radiation as well as chemotherapy cause mitochondria to close their membranes and lose their ability for apoptosis. In the dim and distant past, mitochondria had been bacteria with the ability to use oxygen for energy production. By symbiosis with them, all animals and plants have this ability now. Bacteria, however, react to different kind of environmental stress by closing their membranes. Mitochondria still behave like this. The consequence is that cancer cells are not able to use oxygen for energy production and to start apoptosis. The most recommended therapy against malignant tumors is chemotherapy, beside removal by surgery. It should be obvious that its effect had been proved scientifically. How can this be proved? You need a big number of patients, split them in two parts, where one part receives a placebo and the other one the drug, the verum. If the 5-year survival is higher in the verum group, the drug is effective. This trial had never, I repeat never, been performed with chemotherapy. 2 very good investigations had been done, however, comparing patients who refused this therapy with treated patients. The patient groups were equal in type and degree of tumors. The survival rate in both groups was equal. This means the therapy is unsuccessful with the exemption of leukemia and some tumors in early childhood. Alternatively, a treatment with capsaicin, the pungent of chili, is possible. It is able to open the membranes of mitochondria and start apoptosis. A high amplification of this effect is needed to reduce the necessary amount. This is possible by using quantum dot technology. Until now, this capsaicin therapy had been used in 26 patients, 22 cats and 2 dogs with malignant tumors. In all cases, 100% reduction or disappearance of tumors in weeks or months was found. Without scalpel, without radiation, without chemotherapy. Chili is a spice. Therefore, the substance is marketed as a food additive. To be registered as a drug, 8 to 10 million euros are necessary. Look at crowdfunding of this video. As far as the figures go, each of 1.4 million cancer patients in Germany would have to spend 7 euros only to make a drug available in a few years that really helps. And that is much cheaper, with 80 euros per month or 960 euros per year, in comparison to 20,000 euros per year of current medication. It is easy to buy chili in the next supermarket. To get the effect of apoptosis, however, you have to eat 30 pots of the hottest sort a week. Nobody is able to do this. A therapy is only possible if capsaicin is prepared as quantum dot. The technical term quantum dot cannot be protected, and everybody can use it. The effect apoptosis is only fulfilled, however, if producers or distributors use the term produced according to Quantenpunkttechnologie nach Gradl. You can read this information and including scientific literature in full length at the website www.diagnose-krebs.com. Case studies can be found at www.egaa-recipes.com. 2.1.1.Cancer.com.